A 42-year-old patient came to me complaining about a cough that wouldn't go away. She thought it was allergies. 3 days later, we diagnosed stage 3 lung cancer. This happens far too often, and today I'm going to share 7 symptoms that could save your life. Symptoms that both patients and doctors frequently dismiss. I'm a board-certified medical oncology doctor, and as an oncologist who's treated hundreds of lung cancer patients, I wish everyone knew these warning signs. Here's the reality. Lung cancer is the leading cause of cancer deaths in the United States, but when caught early, the 5-year survival rate jumps to 60%. The problem? Most people ignore early symptoms because they seem minor or unrelated. Today I'm breaking down 7 symptoms in order from most commonly dismissed to most urgent, and I'll explain exactly when you should be concerned and what to do next. Let's start with number 7. Symptom number 7, a cough that lasts more than 2 to 3 weeks. Now I know what you're thinking. Doctor, I get coughs all the time from colds. And you're right, but here's what makes this different. A lung cancer cough typically doesn't improve with cough medicine. May sound different, deeper, or more hoarse. Persists even after other cold symptoms disappear. May worsen over time instead of improving. Here's what I tell my patients. If you have a cough that lasts longer than 3 weeks, especially if you're a current or former smoker, it's time to see your doctor. Don't wait for it to get better on its own. One of my patients dismissed her cough for 6 months because she thought it was from her allergies. By the time she came in, the tumor had grown significantly. Early intervention matters. Symptom 6. Persistent hoarseness or changes in your voice. This one surprises people. They think, how does lung cancer affect my voice? Let me explain the connection. Lung tumors, especially in the upper part of the lung, can press against the nerve that controls your vocal cords. It's called the recurrent laryngeal nerve. When this happens, your voice becomes hoarse or raspy, weaker than normal, strained when speaking. Now, hoarseness from a cold or overuse typically resolves in 1 to 2 weeks. But if your voice has been hoarse for 3 weeks or longer without an obvious cause like yelling at a concert or having a cold, that's a red flag. I had a teacher who thought she just strained her voice from talking all day. 3 months of persistent hoarseness later, we found a tumor pressing on that nerve. If you're experiencing unexplained voice changes, don't ignore them. Symptom 5. Shortness of breath during normal activities. This is where things get more serious. Pay attention to this one. I'm not talking about being winded after running a marathon. I'm talking about getting breathless walking up a single flight of stairs you used to climb easily, feeling out of breath doing household chores, needing to pause during conversations to catch your breath, waking up feeling like you can't get enough air. Here's the medical explanation. Lung cancer can cause shortness of breath in several ways. The tumor blocks an airway, reducing oxygen flow. Fluid builds up around the lung, called pleural effusion. The cancer spreads to multiple areas, reducing lung capacity. This is critical. If you notice your breathing has changed over the past few weeks or months, and it's getting progressively worse, see a doctor immediately. Don't convince yourself you're just out of shape. I've seen too many patients who attributed their shortness of breath to aging or weight gain, when in reality, it was their body's way of signaling something was seriously wrong. Symptom 4. Chest pain that worsens with deep breathing, coughing or laughing. This is different from the sharp crushing pain of a heart attack. Lung cancer chest pain typically feels dull, aching, or sharp in one specific area, gets worse when you take a deep breath, intensifies when you cough or laugh, may radiate to your shoulder or back. Why does this happen? The tumor can irritate the lining of the lung, called the pleura, press against the chest wall, invade nearby structures like ribs or nerves. Here's what concerns me as a physician. Many people dismiss chest pain as muscle strain, especially if they've had a severe cough. Often they think, I probably just pulled something. But if you have chest pain that lasts more than a few days, doesn't improve with rest, is accompanied by other symptoms on this list, you need to get it checked out. Chest pain combined with a persistent cough is a combination I never want to ignore. One patient told me she'd been sleeping in a recliner for 2 months because lying flat made her chest hurt. That's not normal, and it shouldn't be dismissed. Symptom 3. Losing 10 pounds or more without trying. Now, some people might think, that sounds great, but unintentional weight loss is one of the most concerning symptoms in medicine. Here's what I mean by unexplained. You haven't changed your diet, you haven't increased your exercise, you're eating normally, but the weight keeps coming off. You've lost 5% or more of your body weight in 6 months. Why does lung cancer cause weight loss? Several reasons. Cancer cells consume a tremendous amount of energy. Tumors release substances that change your metabolism, loss of appetite from the cancer itself. Your body is fighting the disease, burning extra calories. I tell every patient, unexplained weight loss is never normal. It's your body's alarm system going off. If you're losing weight without trying, especially combined with any other symptoms on this list, you need a thorough medical evaluation. Symptom 2. Coughing up blood, even a small amount. Let me be absolutely clear. This is never normal. Even if it's just a tiny streak of blood in your mucus, this requires immediate medical attention. In medical terms, we call this hemoptysis. It can appear as bright red blood, pink-tinged mucus, dark rust-colored sputum, blood clots in what you cough up. Why does this happen with lung cancer? The tumor erodes into a blood vessel. The cancer irritates airways, causing them to bleed. The tumor itself is fragile and bleeds easily. I don't care if it happened once. I don't care if it was just a little bit. If you cough up any blood, you need to see a doctor that day or go to urgent care. This is one symptom where I've never had a patient regret seeking immediate care. Even if it turns out to be something less serious, like bronchitis, you need it evaluated. I had a patient who coughed up blood once, felt fine the next day, and waited 2 months to tell me. Those 2 months mattered. Don't make that mistake. And symptom number 1, the one that gets missed most often, recurring respiratory infections. This is the sneakiest symptom because it seems so innocent. You think, I just keep catching colds, or I've had bronchitis 3 times this year. But here's what's really happening. When a tumor partially blocks an airway, mucus gets trapped behind the blockage. Bacteria grow in that trapped mucus. You develop pneumonia or bronchitis. Antibiotics clear the infection temporarily, but the blockage remains. So, infection returns. The pattern I see: a patient gets pneumonia, takes antibiotics, feels better. 2 months later, pneumonia in the same lung, antibiotics again. 2 months later, it's back. That's not bad luck. That's your body telling you something is blocking that airway. If you've had 2 or more respiratory infections in the same lung within 6 months, or if infections keep coming back in the same spot, you need imaging, a chest X-ray or CT scan. Your doctor needs to see what's causing this pattern. This is how we catch some lung cancers early, when patients finally ask, why do I keep getting sick in the same place? So let's recap these 7 symptoms. Recurring respiratory infections, coughing up blood, unexplained weight loss, chest pain that worsens with breathing, shortness of breath during normal activities, persistent hoarseness, a cough lasting more than 3 weeks. Now, here's what I want you to understand. Having one of these symptoms doesn't mean you have lung cancer. Many of these can be caused by other conditions, but they all deserve medical evaluation. As physicians, we'd rather see you for something that turns out to be minor than miss an early cancer because you waited. Early-stage lung cancer is treatable. Advanced lung cancer is much harder to treat. If you're experiencing any of these symptoms, especially if you're a current or former smoker, or have a family history of lung cancer, make an appointment with your doctor this week. Not next month, this week. Ask for a chest X-ray or CT scan. Advocate for yourself. You know your body better than anyone. And if this video helped you understand these symptoms better, please share it with someone who needs to know.